Hey there, it's Dr. Noseworthy. I'm excited to bring this special topic to you. This video, we're going to be talking about loss of oral tolerance. Now, if you're watching this video, it's probably because I have chosen to send it to you. We don't send this to everyone because not everybody is in a circumstance where they are reacting to a wide variety of foods that are in their diet. So, no pun intended, but the word loss of oral tolerance is quite a mouthful. To translate that into common terminology, we could also call this a talk about crazy food sensitivities and severely limited food choices. One of the things that I've noticed over the past several years is that we have more and more clients coming in who either on testing show that they're reacting to half or more of the tests or the test items that we're looking at, or they've already coned down their diet to just a handful of foods because they're reacting to everything. And one of the biggest things we have to look at is whether or not they're having reactions for immune activation reasons or for something else. So before we get into talking about oral tolerance and what that means and how we lose it and how we fix that, I just want to go over this idea that you can react to foods for immune activation reasons, what we call sensitivities or true food allergies, or you can react to food for reasons that are not immunological. So the first question, anytime you have a food reaction, meaning you eat something and something bad happens, the question is why? Well, the first non-immunological reason that somebody can have a reaction is based on a blood sugar response. This is typically when people have predispositions to what we call insulin resistance, and that is the mechanism by which someone becomes pre-diabetic and then diabetic, usually type 2. And that's a huge spectrum, right? You can have just a little bit of insulin sensitivity, or it can be really, really bad. You can have what's called the metabolic syndrome, which really truly is prediabetes, or you can be fully diabetic. But anytime somebody has a blood sugar response, one of the things that we see is that the characteristic symptoms that come out of that are very, very specific, and they're the same for every person. And those symptoms are typically post-meal fatigue and cravings. So if I have a blood sugar issue that falls on the high blood sugar side, if I eat too much food at one time, or if I eat too many carbohydrates, even in small amounts, if my insulin resistance is really bad, the usual outcome of that is after I'm done, I feel tired, I want to take a nap, or I have to reach for coffee or some kind of stimulant to keep my mind and my energy going, or I have cravings. I want sugar, I want chocolate, I want coffee. So this post-meal fatigue and cravings, very characteristic of blood sugar, although I do have to tell you that some people have food sensitivities and the inflammatory response can create the same symptoms, but usually it's very easy to tell whether or not a post-meal fatigue or craving symptom is tied to blood sugar, and that actually is probably the most common one. So that's the first non-immunological response. It's a blood sugar issue. The increased blood sugar causes a chain reaction that ends up with post-meal fatigue and cravings, and that's consistent from person to person to person, meaning if I have 10 people with the same issue, they can eat too many carbohydrates or eat too much food at once, and they're all going to have some degree of post-meal fatigue and cravings. Makes it very easy to spot. Now, the other reason why someone might have a food reaction that is not immunological specifically is if they have SIBO. Now, depending on where you are in your program and what we're dealing with you, this may be a term that's familiar to you or not. If it is, great. Just hold on for a second. I need to define it for people who may not have this. But SIBO is, it's called small intestinal bacterial overgrowth. And this is where you get an infection in the small intestine, which is more common than we once thought. But however, most infections occur in the large intestine all the way towards the end of the intestinal system down towards the colon. But nevertheless, some people get an infection higher up in the digestive system. And what happens is these little critters feed off, say, starches and sugars and fibers that might be in your diet. And there are only certain ones that cause it, others don't. But the characteristic response then is gas and bloating, and it's only with certain foods. So again, just kind of like the blood sugar response, this is a predictable and it's a reproducible reaction that does not vary from person to person. It may vary in intensity, or it may vary in the specific foods that cause it, but nevertheless, someone who has a reaction based on a SIBO mechanism, not on an immune sensitivity, these people actually have gas, bloating, abdominal distension, and may even change bowel habits. So you either stop them up or cause some loose stools. But there are only certain foods that fall within a special category of fermentable foods, things that contain compounds, what we call galactans and fructans, and we have lists that tell us which foods those are. But here's the deal. Neither one of these are really strictly food sensitivities. Yes, they're reactions based on food, but a blood sugar response or a SIBO reaction where critters then change what's going on in my gut environment are not really my immune system reacting to those things. And so what we find, and this is one of the ways that we can distinguish between which foods are you reacting to based on immunological mechanisms and which foods are you reacting to but it's not really a sensitivity. This is how we look at this. We look at post-meal fatigue and cravings. We look at gas and bloating with certain foods that we know tend to have these specific reactions. And it's consistent and reproducible from person to person to person to person. This is what we would expect every single time. Now, that's completely different than when someone has a true food sensitivity or food allergy. Let's just use the word sensitivity just to be consistent. If I have a food reaction that's based on turning on my own immune system, which starts in my gut, then what happens is not a picture of symptoms that is consistent and reproducible from person to person. What ends up happening is the picture of food reactivity may vary from person to person, but it's consistent within the person. So here's what I mean by this. If I have a true food sensitivity, the immune system that's embedded in the lining of my gut gets turned on, and that actually causes a systemic inflammatory response. So I get inflammation in my gut, and then that goes systemic, and I'll show you how that happens in just a little bit. But when we get the systemic inflammation, we end up getting a widely varied and diverse set of responses that are based on the person and not on the food, right? So with blood sugar responses, certain kinds of foods like carbohydrates cause specific reproducible symptoms. If I have SIBO, certain kinds of foods cause gas and bloating, abdominal distension every single time in every person. But when it comes down to gut immune activation and true food sensitivities, the food may be the same, but the reactions are different from person to person. Let me give you an example. Let's say somebody has a predisposition to, maybe joint pain and swelling and gaining weight very easily. So they may eat food and their joint and their muscles kind of swell up and they hurt and they gain a few pounds, even though they're not really eating enough food to warrant that. Somebody else may be predisposed to fatigue and headache. So they eat food and they get fatigue and headache. And every time they eat that food, they get the same reaction. But these two people are eating the same foods, but they're getting different reactions that are based on their unique individuality. And that's what I mean by consistent and reproducible for a single person, but not reproducible from person to person to person. So one of the first things that we have to do when we're starting to see these crazy limited diets, either self-imposed or maybe suggested by a well-intended clinician, what we end up with is we have a whole schlemazel, not a scientific term, but we have a whole schlemazel of reactions that we have to try to figure out where they're coming from. And this is actually beneficial for us because in the long run, when you look at those top two categories, the blood sugar responses and reactions based on SIBO, those are temporary issues, right? We can learn to control blood sugar and we can fix your insulin sensitivity so that then you can eat a reasonable amount of carbohydrates without damaging your blood sugar and other metabolic systems. If you have SIBO, we can kill the critters and restore health to the gut so that you can go back to eating foods that caused gas and bloating. These are not immune reactions, and there's no expectation of permanency with these. However, with food sensitivities, some foods that you might be reacting to are probably permanent problems, but depending on you and your unique situation, there may be some foods that you might be reacting to right now that are not permanent issues, that if we can restore oral tolerance, because that's the underlying problem, I understand we haven't really defined that yet, but if we can restore oral tolerance, then what ends up happening is some foods that are causing problems for you today, we will be able to reintroduce somewhere down the road, and you won't react to them as long as you keep taking care of yourself and keep doing all the things that promote good tolerance. So let's talk about where we're going today. In this little mini lecture, we're going to be talking about what I call the tolerance triad. We'll talk specifically about oral tolerance, and I'm going to get a little bit geeky on you with this. I'm going to show you some of the science here. Then we're going to talk about situations where we might have a scary food sensitivity report. What I mean by that is the report comes back and someone's reacting to, say, half or more of all the items that are on the test. And then we're going to finish off with the good news. And I'm going to share with you that the fact that we're completely handling situations like this completely differently than we were a year ago, simply because the research has changed, or the research has told us more about what we need to do with this. So let's define tolerance, and then we'll talk about the tolerance triad. Within the world of research of immunology, the term tolerance is used to refer to the body's ability, or the immune system's ability, to not react to something that could potentially cause an immune response. And these things are called antigens. An antigen is a foreign invader, or a substance that has the potential to create an immune response. And if you have good tolerance, that means that can come into your system, but your immune system doesn't freak out about it. So for example, we would expect an immune response, say, from a bacteria or a virus, but I don't expect an immune response to the proteins that are in my diet. I don't expect an immune response to the chemicals that might be in my environment, say in my personal care products. So when an antigen is not tolerated, then an immune response occurs, right? And again, we don't expect to tolerate viruses and bacteria. In fact, we want a response there, but we don't want response to other things. Now, there are three types of antigens that should be non-threatening. And those things are your own tissue. And so when we talk about this tolerance triad, there's three elements to this. There's tolerance of myself. That means my immune system leaves me alone, but it kills viruses and bacteria or other kinds of critters. Another aspect of tolerance is tolerance to my environment. And that means I don't react to the thousands of chemicals that I'm exposed to on a daily or a weekly basis. And then another aspect of tolerance is the proteins in my diet. And there are proteins that are coming from animal sources and certainly coming from vegetable sources, right? Even vegetables like tomatoes and broccoli and cauliflower have protein in them. They're not concentrated sources like animal proteins, but nevertheless, they have protein structures. Now, this is what the tolerance triad is. And really, these are the same things, right? This is just applying this concept of tolerance to yourself, to your environment, and to the proteins that are in your diet. Now, here's the tricky thing. When we lose tolerance, if we lose tolerance against ourselves, we call that autoimmunity. So if I have, for example, Hashimoto's disease is the most common autoimmune disease out there. It's an attack against your thyroid gland. That is a loss of self-tolerance with proteins that are found inside your thyroid system, right? And it could be rheumatoid arthritis, a loss of tolerance to the proteins in the cartilage of your joints, or it could be multiple sclerosis and loss of tolerance against something called myelin basic protein. So that's loss of self-tolerance, also called autoimmunity. Then we can have loss of environmental tolerance, and we call that generally chemical reactivity. So someone with chemical reactivity, say, gets some kind of a symptom if they smell gasoline or perfume. They may have to change their cosmetics or buy special lotions and shampoos and detergents, or clean their house with certain kinds of natural cleansers because they can't handle the chemicals. And this is an immune response, right? And this is part of the loss of tolerance triad. And then there's the loss of tolerance to dietary proteins, and this is what we call food sensitivities or food allergies. And that's really kind of a big world that's got multiple different components. So I'm going to show you, when I geek out on you in a moment here, I'm going to show you some of the science. I'm trying to simplify things without getting too complicated, but I want to give you enough of the story that you feel comfortable, that you see the big picture and at least have a fundamental understanding of what's going on with you in this circumstance. So the tolerance triad is the same problem manifesting in one or more of three different places, and loss of tolerance to self is autoimmunity, to the environment is chemical reactivity, and to dietary proteins is where you get your food sensitivities. The interesting thing about this triad and how they're all linked to the same problem is that they all share a common underlying metabolic issue, right? And I just said a moment ago that this is really the same problem that can manifest in one of three different ways. And what that means is that when you see one of those three elements in the triad, you have to suspect the others because it's the same problem. So somebody might come into my office and we consult with them and they've got some food reactions, but they have no chemical sensitivity and they have no autoimmunity. But we know that if we don't fix the underlying issues that led them to start reacting to their dietary proteins, that process will continue to get worse over time and it will lead into the others. And so you may start out with food reactivity, but then at some point you lose tolerance to yourself and you trigger some genes for autoimmunity that might be lurking in the background that you don't have turned on right now. Or it might mean that you start reacting to your environment and you're sick and you're getting worse and you don't know that it's maybe, I don't know, I'm just making stuff up, chlorine that's bleach that's being used with your laundry or something, or maybe it's a compound that's in the soaps or the shampoos that you're using. The bottom line is this, is that when you see one, you're obligated to look for the others. And I'll tell you that with our clients who are, say, if I can use this term, the sickest of the sick, we almost always see all three of these, right? We see somebody coming in who might already know that they have an autoimmune disease, but when we go through their consultation, they've got chemical sensitivity and they have inevitably food sensitivities. But we know that those are all the same problem. So we don't have to have a whole bunch of different treatment protocols. We just need to work on the underlying issues that's causing all of these different things. So how do we explain the fact that we have different reactions based on or from person to person? Well, the reality is that unlike blood sugar issues and SIBO reactions, they're not food dependent, they're person dependent. And if you have one person, like the examples I used, who eats a food and gets triggered and then their joints flare up, and someone else, their brain flares up, they might get brain fog or fatigue. The bottom line is that when you have these health issues, you have, and I'm just using the term fire as a metaphor, of course, you have fires throughout your body, right? So one person has a fire in their joints, somebody else has a fire in their brain, and that's what we call brain fog. So wherever your fire is already burning, when you get triggered and you get a food sensitivity response, you get the systemic inflammation, it's like throwing gasoline on the fire that already exists. And what ends up happening is your fire burns hotter and it burns longer. Right? And this is how we understand people have this diverse set of reactions that doesn't vary from person to person, but it's consistent within, or it does vary from person to person, it's consistent within one person. So here's a way to look at it. And this is just an example, of course. I'm representing the green in the sleep to represent normal, the yellow with joint pain to say that this person has a little bit of joint pain, and the red means this person has got brain fog, and that's probably their worst problem. Well, we take this set of symptoms where we have nothing, a little bit, and then a lot going from top to bottom. And if we add on top of that an inflammatory response from a food trigger, what ends up happening is the fire burns bigger and brighter. So the sleep doesn't change because there was no pre-existing problem there. The joint pain goes from yellow, say, to orange and gets a little bit worse, but that person's main issue was brain fog. So when they get triggered, their brain fog gets significantly worse, and that might be what they notice the most. Right? And you may be able to sit back and say, okay, I recognize that. Maybe it's not brain fog with you, maybe it's something else, but I'm just trying to illustrate a point and help you understand why certain things might be happening with you when you're interacting with certain kinds of foods. So I want to move now, and this is where we get to geek out a little bit, and I'm going to show you just some of the fundamentals of what's happening inside your gut and then what ends up happening systemically. But on the left-hand side here, we have animal and plant proteins, right? You're eating chicken and fish and whatever, and you're having tomatoes. Maybe you're having tomatoes. I'm just going to list some foods, right? You're at, greens and tomatoes and squashes, whatever. So all of these contain proteins. Now, what are proteins? Proteins are complex molecules that are made up of individual amino acids. And the easiest thing to think of would be thinking of like a pearl necklace. And imagine that each of the individual beads on the pearl necklace are the amino acids. And you may have heard terms like isoleucine or valine or leucine or glutamine. These are all different kinds of amino acids. And if you string a bunch of those together and then you twist it around and kind of tie it up into a complex three-dimensional shape, that's what a protein is. And different proteins have different amino acids, and they have different amino acid sequences. And this is how we end up getting different proteins, is that we assemble them, all of the amino acids, in different ways, and we kind of fold it up and connect it together into these three-dimensional shapes in different ways. Well, when these proteins come into your diet, you have to break those down because you can't absorb a protein. You can absorb an amino acid, which is that small building block, those individual pearls on the pearl necklace, but it's all based on whether or not you have efficient protein digestion. And I'm talking about your ability to make hydrochloric acid in your stomach and the ability of your pancreas to release things like proteases, and there are several different kinds. So as long as you have that efficient protein digestion, then you can break your dietary protein down into individual amino acids. And let's make an assumption that you've got a healthy gut. Well, this is the best case scenario for two reasons. One, a healthy gut lining typically means that my immune system is under control and it's not primed and it's not ready to fire off a reaction. See these guys down here, these what are called dendritic cells. These are specialized, a special kind of cells called a macrophage, which are even further specialized. And really what they do is they act like your border guard, or they act like security guards, and they're going up and down through your gut lining, constantly looking around to see what's going on. It's called a sampling process. And these dendritic cells are constantly sampling the environment and trying to decide whether or not they've got something that they need to bring to the rest of the immune system to create a response. And part of the rest of the immune system is this guy here called a regulatory T cell. Now, these dendritic cells, when the lining of the gut is really healthy, and when you're efficiently digesting your proteins and all you have interacting with the lining of your gut are amino acids, that's when you absorb your nutrients and you really have no immune response. Your dendritic cells might pick up a few things and go, oh, that's just an amino acid. There's no reason to get bent out of shape over that. And that's the ideal scenario. That's normal, healthy gut immune responses. Now, however, we know that things go wrong, right? And we're looking at this video because we're in a situation where you've got stuff going on with your food reactivity. So what happens when things do go wrong? Well, a couple of things. One, and this is what the research shows, is that when you're dealing with food reactivity, you're far more likely to create reactions if your protein digestion system is compromised. So if you've got something that is decreasing your hydrochloric acid production, what ends up happening is that instead of breaking down these complex protein molecules into small individual amino acids, right, going from a big fancy necklace down to the individual pearls, what you end up with are chains or segments of amino acids, or let's call them protein fragments. And these things are big enough and heavy enough that when they bump into the lining of the gut, that's when the dendritic cells are more likely to pick it up and say, whoa, I don't like this because this doesn't look like an amino acid, and I'm used to looking at only amino acids. So if we have faulty digestion, faulty protein digestion specifically, that's the first thing that tends to promote immunogenicity or allergenicity or increased sensitivity. Now, the other thing that can happen is if the lining of the gut is unhealthy, what ends up happening, that's a very complex statement by itself, but these dendritic cells, what ends up happening is they end up going into what's called a primed state. And a primed dendritic cell is hypervigilant. And that means that as it's patrolling around the environment, it's sampling like crazy, and it's more likely to look at something and get bent out of shape. And then its job is to take that and say, hey, guys, and talking to the other parts of the immune system, I found something that I think we need to do something about. What are we going to do? And so in the bottom row of bars and arrows here, when we have amino acid fragments or protein fragments and chains of amino acids being exposed to an unhealthy gut that has a hypervigilant set of dendritic cells, this is where we end up getting immune responses, and it changes what goes on in the lining of the gut. And what ends up happening is we end up having lack of absorption of nutrients. Now, you're not going to become totally nutrient deficient, but it's going to change how you're absorbing your nutrients. But more importantly, it's going to trigger an immune response that starts in the gut but ends up going systemic. And we'll come back to that in just a moment. So the degree and the extent of reactivity is highly variable. Over here on the left, where we have this situation that we just talked about where we have protein fragments being exposed to an unhealthy gut lining. We have nutrients not being absorbed and the immune response is triggered. And the degree and extent of reactivity is really ultimately based on the balance between your dendritic cells and your regulatory T cells, or what are called Treg cells. Now here's the difference. Your dendritic cells are your patrollers, your sentries, your security guards that may be hypervigilant, and they're picking up stuff and going, okay, I don't like this. We got to do something about this. Your regulatory T cells are like the conductor of an orchestra. They're the ones that really determine whether or not you end up having a response. Because if you have a really good, healthy regulatory T cell system, which unfortunately we have no testing to show what your regulatory T cells are doing. Hopefully in the next about 5 years, we're going to have a test that will show that. But if you have a really robust, strong regulatory T cell system, the dendritic cells can freak out, but when they bring those protein fragments, the regulatory T cell says, it's just a little fragment, it's not a big deal, and you don't get a significant response. You might get a little one, but it doesn't go crazy and you're not reacting to everything that's coming into the environment. The problem comes when we have this. The problem comes when we have dendritic cell priming, where your dendritic cells are really hypervigilant and they're picking up these fragments all the time and freaking out. And then they're running to the rest of the immune system. And if the conductor's taken a nap, or if he's just not really good at conducting and leading the immune response, when your Treg cell function goes down, what ends up happening is massive immune reactivity or multiple immune reactivity, or both of those. Like you're reacting in great ways to multiple things. So the balance between your regulatory T cell function and your dendritic cells is really critical. Now I'm getting very sciencey on you, and honestly, this is the kind of stuff that we're teaching doctors. And believe it or not, most doctors don't even know what a dendritic cell is, and if they know what a regulatory T cell is, it's only because they've gone to a seminar, kind of gone out of their way to learn it, because this kind of stuff isn't taught in medical school, chiropractic school, acupuncture, naturopathic, or whatever. This is all kind of leading edge scientific or science research. Now, a couple of things, and I'm just going to make this real quick. The things that cause dendritic cell priming are pretty much the same thing that cause your regulatory T cell function to go down. And those would be things like chronic stress, gut infections, hormonal imbalances, blood sugar issues, anything that either causes inflammation or messes up the gut, right? Constantly eating foods you're reacting to will make this worse. And so you end up having a vicious cycle where the very things you're trying to fix are the very things that are creating the problem, or creating the mechanism that creates the problem that you're trying to fix. And you just end up going round and round and round and getting worse over time. One of the things that we see routinely is clients will come in and say, Doc, the last year or two, I can't eat the same foods I could last year or the year before. And like I'm down to eating like 7 foods over and over and over again. Well, the problem is that if you don't fix the loss of oral tolerance, whatever foods you're eating over and over again, you're going to eventually start reacting to those as well. And so, where do you go and how do you manage that? So what I want to do right now is I want to show you a video that we actually use in our lectures to the doctors that come to our seminars. And what this is going to do, it's going to give you a little bit of a mental picture of what's happening. I'm not going to get too detailed and explain too many different things. But what you're going to see is you're going to see the dendritic cell coming in. It's going to look like a big spidery thing from outer space. And it's going to hand off the protein fragment to another series of cells. And it's going to end up in a certain kind of immune cell called a B cell making antibodies. Right? This is how your immune system reacts to certain proteins, is that your dendritic cells bring it to the cells that make antibodies to that specific protein. So you have specific antibodies to, say, gluten or dairy proteins or tomato proteins or whatever the case might be. Now, as that goes, what you're going to see is the regulatory T cells come in down here in the bottom left corner, and as long as they're good and robust, they shut everything down, so it limits the response. And I'll give you just a little bit of commentary as we go through. So the first thing you see here is you see your dendritic cell, and it's handing off the protein. And this is coming over, talking to another couple of cells called the Th2 cell and the B cell. Now this B cell is going to start making these little yellow things here called antibodies. And right here that's your regulatory T cell. Right? Once the dendritic cell comes in and starts turning on your immune response, the job of that regulatory T cell is to come in and communicate with these cells to say, hey guys, calm down. And as long as that works, we get minimized responses or we get no responses at all. But once the antibodies are being produced, I'll turn this on and you'll see the video focus over here for a second. All these little yellow fragments that are coming out of these, what are called B cells here, end up binding to the protein so your immune system can destroy it. But they also end up triggering histamine cells or mast cells that produce histamine. So here we have the regulatory T cell shutting everything down and turning it off. And now all of these little antibodies that are coming out then create immune responses directly against the proteins wherever they're found. And now you see these antibodies coming down and docking on these receptors to the mast cells. And then the mast cells then will release these little green globules, which are your histamine. Now, Histamine can mess up a whole bunch of things, and we kind of think of histamine as being part of allergies, right? Itchy eyes and sneezy, watery nose, and that certainly happens with some people. But histamine can affect other things. It doesn't have to affect your sinus system. It can actually affect your cardiovascular system, the lining of your tissues and your synovium and your joints, because there are histamine receptors everywhere. So we don't necessarily get that classic allergic rhinitis, itchy eyes, sneezy kind of response. It can manifest in many different ways. That's really what's going on when you have food reactivity that's not being controlled. So the other thing that we want to talk about here is that reactivity is not just widely diverse based on the balance of how primed your dendritic cells are, how capable your regulatory T cells are. Reactivity is also both local in the gut and it's systemic. This is a paper that was published back in 2012. And one of the things that the researchers were trying to capture in this little diagram was that once you get this immune reaction in the gut, and this little tube here represents your intestinal system, these little dendritic cells end up migrating out of the gut. They go through what's called the mucosal system. You go through the lining of the gut, and they travel along these channels, and they end up in what's called the mesenteric lymph node, and that's the lymph nodes that are all around the gut. And then from the mesenteric lymph node, then they go into the peripheral lymph nodes throughout the body, and then they end up going out into systemic circulation. And so this is a very kind of, I was going to say elegant, but it's kind of cartoonish, but it's an elegant, cartoonish way of saying, hey, this is not just about the gut. In fact, we have clients all the time kind of mistakenly thinking that they don't have food reactions because they have no gut symptoms. But they can't sleep, they've got brain fog, they have cognitive changes when they eat certain foods, they get depressed or whatever the case might be. These are clearly systemic reactions, and now we understand how that happens. Now, going through the lymph node system is one way that it gets into systemic circulation. The other way is by going through the liver, following this red pathway. So again, these dendritic cells migrate through the portal vein and go to the liver, and guess what? Inside the liver, there's a whole bunch of other immune cells called Kupffer cells. And these Kupffer cells then can react. And so the health and the status of your liver is important. And it doesn't mean that you have to have liver disease like cirrhosis. But imagine this. Let's say that you're kind of full of toxins and chemicals and you don't clear those out well. The process is called biotransformation. If you're not a good biotransformer, if you're not a good detoxifier and metabolizer, then when those proteins and dendritic cells hit the liver and hit the liver-based immune system, you're going to get kind of a second explosion, a kaboom. You get one in the gut, and then you get another systemically, and you get one in the liver, and then from the liver, that goes systemic as well. And this is, from a scientific basis, how we understand somebody can eat a food and have a cognitive or behavioral change. Or you can eat a food and get swelling in your ankles, or you can get a headache, right? This is all based on systemic inflammatory responses. Now that was kind of geeky, as I said, but let's go to the next topic now, which is talking about some of these scary food reactivity reports. Now, we don't always run food sensitivity panels on all people. There are reasons to run it and reasons not to run it. I'm going to show you one of these crazy reports here in a second. Sometimes people come in and they're already on ultra restricted diets. They've done that on their own, and in that case, testing is not appropriate. We're going to spend an awful lot of money to get a whole bunch of negatives because they're not eating the foods and not creating the reactions, right? They've been preventing those. Sometimes we might have to run a test, and really the decision to do it or not to do it is really based on individual circumstance, right? But nevertheless, sometimes we run a panel, and in this particular test, this is from Cyrex Labs, it's called Array number 10. This is just one page of a 7-page report. And if you look here, green is good, yellow is bad, red is worse. So both the yellow and the red zones are considered positive or highly suspicious findings. And you look at this and you go, wow, that's crazy. That person is reacting to more than half of what's on that page. Well, imagine that if every single page looks like this. In fact, I'm only showing you one page, and this particular test for this particular client is actually like this. Every single page has got more things in the yellow and the red zone. So what do you end up doing? Do you end up saying, I'm sorry, client, but you can only eat the foods that are in the green zone? The answer to that is, up until a while ago, that's what we used to do. Until our understanding of immunology and our understanding of what these tests are actually telling us have completely changed. So let's look at it this way. Let's say that you do have a test like this and you're reacting to, say, more than 50% of what's in the test, right? That is clearly a situation where you've completely lost oral tolerance. You've got this crazy dendritic cell priming. They're hypervigilant. They're sampling everything and bringing it to the rest of the immune system. And the regulatory T cells are just not competent enough to prevent reactions. And so you end up with these antibodies to pretty much everything that's coming in through your diet. Well, what if you're reacting to less than 50? What if you're reacting to 20 or 30%? Well, obviously you're losing tolerance, right? This is a continuum and it's a spectrum. At the far end, when you've lost oral tolerance, you're reacting to all kinds of things. But in the beginning, you might react to only a handful of foods. So we still look at someone who has a less reactive report as being on that sliding, slippery slope. And if we don't do something quick, we're going to end up with a report that looks something like this. But I want to go back to the triad. Do you remember that we talked about how losing oral tolerance means that losing tolerance means one of three things, or one or more of three things. You're reacting to your foods, reacting to your environment, reacting to yourself. So whenever we have a circumstance like this, it's always a good idea to cross-check someone for autoimmune reactions or for chemical reactivity. And certainly we have testing that we can do that with. Now, what's the problem with these hyper-restricted diets that people are making themselves follow or following based on someone's recommendations? Well, the first thing is that they're really, really hard to stick to. I mean, try eating only 3 or 4 or 5 or 10 foods over and over again. Not only is there kind of not a redundancy, but it becomes very mundane and very boring. But over time, you end up reacting to the things that you're eating over and over again. The other problem here, and this kind of gets a little bit geeky, is that the lack of diversity, when you have these hyper-restricted diets, the lack of diversity becomes part of the problem. Now, follow with me here for a moment. I didn't create a slide because I didn't want to throw too many things at you, like I haven't done that already. So the lack of diversity leads to what we call a poor microbiome, and that's basically the profile of all the probiotics in your gut. With these healthy bacteria, what we want is we want really high numbers, and we want a diversity of species, and that only comes by having a diverse diet, by not eating the same things over and over again, and by making sure that we're eating not just a diversity of, say animal proteins, but all different kinds of fruits, all different kinds of vegetables. We're rotating things all the time. This is actually what helps our microbiome, and that's a good thing because part of what these happy critters do for us is they make compounds like short-chain fatty acids, things like butyrate and propionate, and these things actually help your regulatory T cells recover. So this is one thing that's really important, is that when we come down to programming for someone who's got a loss of oral tolerance, creating a diversity of diet is really critically important because we need your healthy critters working for us and not just sitting on the couch doing nothing, or even worse, working against us. So the goal, when we see somebody who has lost oral tolerance, whether we have a scary food reactivity report or not, the goal is to have a diverse diet of plants, vegetables, and fruits, because these are the things that feed your happy critters. But the diet has got to be non-reactive, meaning that we can't intentionally or accidentally on purpose be eating foods that are actually creating immune sensitivities. So we want a diverse, non-reactive diet. And we have to factor in certain other things in some circumstances. So we don't want to feed bad critters, like especially if you've got SIBO, there are other modifications that we might have to make. We also want to make sure that we're not eating a whole bunch of fruit and we're destroying our blood sugar. So there might be some guidelines that we have to follow, but the diversity is really critically important. This is exactly the opposite of what we have been doing up until this last year, because we've been looking at these crazy scenarios going, okay, you can only eat 5 foods, and that actually was creating part of the problem here. So now we're going the opposite direction. What we're seeing with our clients that we're doing this with is we're seeing things change, right? And the interesting thing is that we may get this crazy, scary food reactivity report back, and the truth is not everything on that is accurate. Now, it doesn't mean that the testing is invalid, but when you have this lack of oral tolerance, you end up with what we call false positives. It looks like your immune system is reacting, but there are some reactions that you're actually not reacting to, if that makes sense to you. So it takes a little bit of work to figure out which is which. So this is one area where we really have to truly individualize things. And I need you to work with us to clarify how to diversify your diet. Because we want, number one, we want you to get better. We want to do it in a way that gives you more choices. And by doing it that way, we actually guarantee better outcomes, right? Because we're actually feeding into how the body and how the systems are designed. So one of the interesting things now, and this is in our final commentary, and the good news is that one of these scary food sensitivity reports is no longer a prescription, if you will, of what's safe to eat and what's not safe to eat. We can take a report like we saw just a moment ago, and we have a process where we sit down with you and we go through them, and we actually try to figure out which ones are the main culprits and which ones we can actually allow you to go back in and add into your diet for the sake of diversity. So what ends up happening is it's no longer a list of safe and unsafe foods. It's a gauge of your oral tolerance, of how bad that is. And what that means is that over time, 6 months or 8 or 12 months down the road, as long as we're doing the right things and we're fixing your oral tolerance issues, we can repeat that test and we'll see a whole bunch of things not reactive, even though you've still been eating them in your diet, right? So there may be false positives on a test if you've had that, not because the testing technology is invalid or we made the wrong choice in the test, but because your immune system is tweaked and your dendritic cells are crazy reacting and you're creating antibodies, but that's not the only way or reason why you would actually create symptomatology. So here's the summary very quickly. Loss of oral tolerance is the same as other tolerance issues, right? Loss of self-tolerance, loss of environmental tolerance. It's about protein digestion, the health of the lining of your gut, whether you're infected, do you have leaky gut? It's about dendritic cell priming. It's about the capacity of your regulatory T cells and how these things drive your systemic inflammatory responses, throwing gasoline on fires that already exist. As I said a moment ago, this is one area where absolutely everything has got to be individualized, right? And we do see clients now where we're going through this process and we're repeating their scary food test reports and they're coming back looking so much better. So here's the plan. Now, this obviously needs to be massaged and tweaked based on each individual person, but this is the stuff that I have to think about in a circumstance like this, right? Starting on the left and then going around the horn. We have to optimize digestion and then fix the cause, right? If there's a lack of hydrochloric acid or proteases come from the pancreas, we need to fix that. We need to reduce gut inflammation. We need to fix leaky gut if that's there. We have to support good, healthy mucosal responses in the gut. We have to kill critters if you have them. We have to do certain things that reduce your dendritic cell priming and their ability to invoke a response in other parts of the immune system. And we have to take your regulatory T cells and pick them up off the ground and say, okay, dust you off. Let's help you work better to control everything. And then we have to do what we can to inhibit those mast cells from releasing histamine. Now, I usually try not to get too geeky on you, but this is one of the areas that, honestly, I've just been so excited because it's really dramatically changed what we've been doing with our clients, and we're seeing such better results than we were a year ago in these kind of scenarios. But this is why they call it practice, right? Research comes out, and if you're paying attention, you can change what you're doing in clinic, to make sure that your clients are getting better. And that's something that I'm happy to say that we've been doing lately. So that's it for today. I know it's been a lot. Replay this one if you want. Ignore the parts that get a little bit too geeky for you, but let's make sure that we focus on the big picture. We'll talk to you again soon.